Okay. So tell me how you got me. We can go now? Okay. Okay, great. Well, good afternoon. I'm Paulette. I'm Mayor Paulette Guajardo. On Monday, the Food and Drug Administration expanded emergency use of the Pfizer vaccine to children ages 12 to 15. And on Wednesday, the Centers for Disease Control also recommended Pfizer's vaccine for the same age range. This is a very positive development as we're seeing access to the vaccine expanding to include the protection of children. To date, Nueces County has administered 251,000 doses of the COVID-19 vaccine, and people are continuing to get vaccinated daily. My goal is to provide a vaccine to every resident who would like one. It's easier than ever now to find a vaccine here or a vaccine clinic here in Corpus Christi. The health department is now offering pediatric vaccines to children ages 12 to 15, in addition to vaccines available for ages 16 and older at the La Palmera Mall Vaccine Clinic. Additionally, a second vaccination location has been added at the Greenwood Senior Center to accommodate anticipated demand. The La Palmera Mall Clinic, vaccination clinic, is open Monday through Saturday from 10 a.m. to 8 p.m. and Sunday from 11 a.m. to 6 p.m. And the clinic is located in what used to be Charming Charlie's store, which is catty corner from Grimaldi's Pizza. So first and second doses of Moderna and Pfizer, as well as the single-dose Johnson & Johnson vaccines, are available at this location. The Greenwood Senior Center Clinic, located at 404 Greenwood Drive, is a walk-through clinic that will be open today until 7 p.m. and will operate on Friday, May 14th, from 2 to 7 p.m., and Saturday, May 15th, from 9 a.m. to 3 p.m. The Greenwood Senior Center will have first and second doses of Pfizer vaccine, and their new hours for the clinic will be announced next week. Registration is not necessary for either location, but patrons can continue to pre-register by phone by calling area code 361-561-1101 or by visiting cctexas.com/vaccine registration online. So walk-ins are also welcome on a first-come, first-served basis at both locations we just spoke of. The Health District is also anticipating that the Moderna and Johnson & Johnson vaccines will open up to younger age ranges soon. And for senior citizens, the disabled, and those without access to transportation, the Save Our Seniors or SOS program is still here to help you. All registrations for SOS are taken via phone by calling the hotline at area code 361-826-3900, and that's Monday through Friday from 8 a.m. to 5 p.m. I wanted to encourage everyone to use this incredible resource to receive your vaccine if you've not been able to visit a clinic. And I'm really grateful, again, to our firefighters as they continue to inoculate some of our most vulnerable residents in the community right at their doorstep. And for those of you who've received your vaccine, please know that it is critical that you receive both doses of your vaccine. Don't stop at one. Please make sure you go back to get your second dose, because skipping that second dose will not be as effective in preventing the spread or providing complete protection needed against the virus. And to that point, a recent report by the Centers for Disease Control and Prevention found that Pfizer and Moderna vaccines are 64% effective at preventing hospitalizations in the elderly after the first dose, but 94% effective after 2 doses. It's going to take all of us working together and continuing to work together to end this pandemic. And one way that you can contribute is by getting vaccinated if you so choose to. Some good news is that cases and hospitalizations have not surged since Governor Greg Abbott rescinded the mask mandate and allowed businesses to operate at full capacity. And on another front, I would like to announce that the City Council chambers will reopen to the public on Tuesday, June 8th. Residents can now provide public comment in person in addition to submitting written public comment or phone-in comments. So we're very excited about resuming some normalcy to City Council chambers, and we hope to see you here. That said, I would also like to remind everyone that throughout the COVID pandemic, public comment was allowed via written and telephone. So there was always an opportunity to send in your thoughts or comments, but now we're going to go ahead and open it up for you to actually come in. And we're, of course, going to be following COVID-19 protocols, including temperature checks when entering the building, facial masks in council chambers, as well as during public comment, and seating in the chambers will be socially distanced between parties. So we look forward again to seeing you here. And I want everyone to know, actually, that moving forward, I believe that following our COVID protocols, getting vaccinated, and being mindful of good hygiene, that we can all expect to see more normalcy as we move ahead and enter into our summer months. So with that, I'll pause for Spanish translation, and then we will hear from Public Health Director Annette Rodriguez.
El lunes, la Administración de Alimentos y Medicamentos expandió el uso de emergencia de la vacuna Pfizer a niños de 12 a 15 años y el miércoles los Centros para el Control de Enfermedades también la recomendaron. Hasta la fecha, el condado de Nueces ha administrado más de 251,000 dosis. Junto con la clínica de vacunas, la Palmera Mall, además se ha añadido una segunda ubicación de vacunación en el Centro para Adultos Mayores Greenwood para satisfacer la demanda anticipada. La clínica en el centro Greenwood, ubicada en el 404 de la calle Greenwood, es una clínica ambulatoria que estará abierta hoy hasta las 7 y operará el viernes 14 de mayo de 2 de la tarde a 7 de la tarde y el sábado 15 de mayo de 9 de la mañana a 3 de la tarde. El centro Greenwood tendrá la primera y segunda dosis de la vacuna Pfizer. El nuevo horario de la clínica de vacunas para el centro Greenwood se va a anunciar la próxima semana. No es necesario registrarse, pero los usuarios pueden preinscribirse por teléfono llamando al 361-561-1101 o por internet visitando la página cctexas.com/vaccine registration. Para las personas de la tercera edad, los discapacitados y los que no tienen acceso al transporte, el programa Save Our Seniors o SOS continúa ofreciéndose. La línea directa de registro para ese programa es el 361-826-3900, de lunes a viernes de 8 de la mañana a 5 de la tarde. Si ha recibido su vacuna, recuerde que es importante recibir la segunda dosis para que la vacuna sea eficaz. Un informe reciente encontró que las vacunas Pfizer y Moderna son 64% efectivas para prevenir hospitalizaciones en ancianos después de la primera dosis, pero 94% efectivas después de 2 dosis. Desde el 8 de junio, la Cámara del Concilio abrirá sus puertas al público para quienes quieran dar sus comentarios en persona. La opción de dar comentarios por teléfono o escritos también va a continuar. Solo le pedimos que siga los protocolos de salubridad que existan al momento si es que viene al ayuntamiento a dar su comentario en persona. Ahora el reporte de la directora del Distrito de Salud, Annette Rodriguez.
Thank you, Gabby. Annette Rodriguez, Health Director. So I'm going to start with the Nueces County statistics. And the first slide is going to show the number of cases over the last 2 weeks. And so if you look at on the far right, starting at 60 up to 57 cases on May the 6th, that's a total of a 7-day average of 51 cases of COVID-19 in Nueces County per day. And if you look at this last week, including today, it's also an average of 51 for a 7-day average. So it's kind of interesting. We're kind of looks like maybe plateauing a little bit, but still we have good news this week for everyone. Next slide. So the pie diagram basically shows that 40,720 people have fully recovered here in Nueces County, and that we still have 879 active cases of COVID-19. But that's a really good number because I think if you remember about a week ago, it was over 1,000 active cases. 812 deaths so far for a total of 42,411 cases in Nueces of COVID-19 since March of 2020. This shows our hospitalization patients that are in the hospital with COVID-19. And if you look at last week, the average, if you take an average for the week, it was 39.7 was the average per day that people were hospitalized for COVID-19. And this week, the average has gone down to 34. So again, that's good news, and we're all watching it. If you look at the ICUs, you can see a significant decrease just by looking to your far right at 22, and then looking right here on today's date, 11 people hospitalized and in the ICU with COVID-19. So the numbers are starting to come down, which is telling us that our vaccination clinics are working. Our total deaths, again, this is a cumulative number, so it's always going to go up. It's 812. And the last slide, that includes 3 deaths from today. Our condolences do go out to those family members. It was 1 female and 2 males, and their age ranges were from the 60s to their 80s. So if you look at last week, you see a lot of empty spaces, which is really amazing news, with just 1 case last week, which was 1 death last week, compared to this week we have had 6 deaths this week due to COVID-19. But it continues to look better in the horizon, and this is all, really good news on what we're seeing their vaccine clinics are doing to help with the process. So I wanted to also mention that as a region, I don't usually talk about the region, but as a region, let me see if I have it here. As a region, we actually had a decrease as well. And so the Public Health Department falls under Region 11, our health department, and that goes from south of Victoria all the way down to the valley and across to Laredo. And so last week, when they looked at their 7-day cases of COVID-19, for the whole Region 11, it was 1,150 COVID cases. And this week, it was 727 cases. It's the biggest drop that we've seen since the beginning of this pandemic. So that's really great news. So I was just excited. I had to say that. So, but more exciting news is that CDC is basically telling everybody that if you're fully vaccinated, you can participate in indoor and outdoor activities, large or small, without wearing a mask or physically distancing. So that's, again, more amazing news. And if anybody, that knows me, I don't amaze easily, and I'm amazed. So the messages are really that over the course of the pandemic, we're regularly monitoring the new data as it comes in and reviewing the science to inform our guidance and decision-making. Based on the latest science, CDC says that anyone that is fully vaccinated can resume activities. So indoor or outdoor, safely without a mask or physically distancing. This is just really amazing news. The science is very clear. If you're fully vaccinated, you are protected, and you can start doing the things that you stopped doing because of the pandemic. So over the past few weeks, cases have continued to fall dramatically, and a growing number of studies have shown 3 big news items. One is our vaccines are working in the real world. Studies show them to be greater than 90% effective in the real world setting, which is settings like Nueces County, like the Valley. They're looking at all of these places and they're taking that data in preventing not only mild cases of COVID-19, but also severe disease, hospitalizations, and deaths. Number 2, our vaccines have proven to be effective against the SARS-CoV-2 variants that are currently circulating in the United States. And number 3, if you're vaccinated, you're less likely to spread the virus. A growing body of evidence suggests that fully vaccinated people are less likely to have asymptomatic infections and to be able to transmit the SARS-CoV-2 to others. That means for vaccinated people, life can begin to return to normal. So, very, very excited. Since April the 19th, anyone aged 16 years and older has been eligible to get vaccinated against COVID-19. And as of yesterday, as the mayor mentioned, Pfizer vaccine was also approved for those 12 years and older. And so we already have schools that are calling us and trying to get their kiddos vaccinated before the year ends. We have a very strong supply of vaccine currently. Anyone who wants to get a vaccine can definitely get it. So getting a COVID vaccine is much faster and more convenient than ever. We're not asking you to make appointments. We're just asking you to come in. We have the mall at La Palmera Mall, where Charming Charlie's used to be located, right behind P.F. Chang's, and we're open every day, so Monday through Sunday. So if you're close by, please stop by and get vaccinated. We are also open today and tomorrow and Saturday for those 12 to 15 years of age. So we want to get them vaccinated now that the ACEP and CDC have approved them getting vaccinated. So tomorrow they can come by the Greenwood Senior Center, and that's between 2 and 7 p.m. And then on Saturday, that's between 9 and 3 p.m. And that's just kind of an anticipation that there's going to be a lot of people at the mall. So if you're closer to the health department, come by the Greenwood Center, and we'd be happy to vaccinate you there. So what about a mask on transportation? I think a lot of people are still wanting to know, what about if we're going, everybody wants to travel now, we want to get on an airplane. If you travel, you're still required to wear a mask on planes, on buses, on trains, and other forms of public transportation traveling into, within, or outside of the United States, and in U.S. transportation hubs such as airports and stations. CDC will continue to update guidance and policies as the science emerges and more people are vaccinated. So some people are asking why the new change? Many forms of public transportation, including a large number of people vaccinated and unvaccinated in small spaces that could increase the risk of unvaccinated individuals. So CDC is currently reviewing those guidelines and policies to determine whether changes need to be made. Another question is, how will people know if someone's vaccinated? That's a great question. I've been thinking about that, as well. You may not know if someone around you is vaccinated or not, which is why we're encouraging everyone to get vaccinated, because we know the benefits. It protects you, it protects others, and it lets us begin to return to normal. So we hope everyone takes advantage of this important tool to stay safe and end the pandemic. Vaccination is safe, available, and free. What does it actually mean to be fully vaccinated? In general, people are considered to be fully vaccinated 2 weeks after their last dose. So for Pfizer and Moderna, it's after the second dose, and for Johnson & Johnson, it's 2 weeks after that one dose. If you don't meet these requirements, regardless of your age, you are not fully vaccinated. Keep taking all precautions until you are fully vaccinated. So if you're 8 years old, you still have to wear a mask. If you're vaccinated, you're less likely to spread the virus. A growing body of evidence suggests that fully vaccinated people are less likely to have asymptomatic infections and to be able to transmit SARS-CoV-2 to others. Taken together, the science is encouraging and shows that vaccinated people are protected and less likely to carry the virus to others. So with all this evidence in mind, CDC is recommending that vaccinated people no longer need to wear a mask. So what about if you're immune compromised? So if you do have a condition or you're taking medications that weaken your immune system, you may not be fully protected, even if you're fully vaccinated. So talk to your healthcare provider. Even after vaccination, you may want to continue to wear a mask, because remember, there still is virus that's spreading in our community. What if there's a surge or if other variants emerge? Will we need masks then? The past year has shown us that this virus can be very unpredictable. So things, if they get worse, there is always a chance we may need to make some changes or make changes to the recommendations. But we know that the more people that are vaccinated, the less cases we will have and the less chance of a new spike or additional variants emerging. What about my child who isn't 12 yet? So that's the one I talked about a few minutes ago, the 8-year-old or the 5-year-old. A child under the age of 12 who is not vaccinated will still need to take precautions, including wearing a well-fitted mask when out in public. Are there any people who are fully vaccinated who should still wear a mask? And yes, we talked about those. Those are people that have medical conditions or weakened immune systems. If I'm in a community with a lot of cases of COVID-19, is it still okay for me to take off my mask? If you're fully vaccinated, the data shows that the vaccines are effective and you're protected. That being said, CDC says that if you're in a community with lower vaccination rates and higher rates of disease, you may still choose to wear a mask to even further reduce your risk. What about schools? Can they now take off their mask? As of now, CDC says the school guidance needs to stay in effect because many students are still not vaccinated at this time. What about teachers? Teachers, school administrators, and staff should continue to follow the CDC school guidance, again, because there's still many students that are not vaccinated at this time. So what can I do again? One more time. Tell me what I can do if I've been fully vaccinated and it's been more than 2 weeks since my second dose. You can resume activities that you did prior to the pandemic. You can resume indoor and outdoor activities without wearing a mask or staying 6 feet apart, except where required by federal, state, local, or territorial laws, rules, and regulations, including local businesses and workplace guidance. Remember, all adults just became eligible on April the 19th. Not everyone has had a chance to become vaccinated yet, including some vulnerable communities. So is this too soon to lift these precautions? If you're not fully vaccinated, you should continue to wear your mask and protect yourself and others who have not yet been vaccinated. But again, the science shows that us that are fully vaccinated are protected. So we would encourage everyone to get vaccinated as soon as possible. Again, vaccines are available. So since many communities are now beginning to reopen, but some are requiring masks, what should they do? So we have a responsibility, CDC, to tell people what activities are safe for them. When it comes to decisions about reopening and what communities should do, each community is going to have to make those decisions that are right for them based on their situations in their community. Is CDC doing this in reaction to growing criticism, including criticism from the public health community? CDC has a responsibility to make recommendations based on a body of evidence and what the science tells us. In the past couple of weeks, the science has shown that vaccines work in the real world. So not just in clinical trials, but actually in the real world, they work. They stand up to the variants that we currently have in the United States, and vaccinated people are less likely to transmit the virus. We need to take the time to review the full body of evidence to get this right, and that's how we came up with the decision. The other important information is that, well, at one time we were only testing 1% of the COVID cases to see if there were variants. Now that has increased in the United States up to 10%. So we feel like there's a good feel for what's actually going on, how many variants we have out there, and how the vaccines are still working. And if you look at when the vaccines came into play and how the numbers are taking that steep decrease, the COVID cases, you can see that people being vaccinated has really helped to kind of start putting an end to the pandemic. So with that said, I hope everybody that's eligible gets vaccinated as soon as possible so you can be fully protected and go back to regular daily activities. Stay well, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 42 casos confirmados por el coronavirus. 40.720 pacientes se han recuperado por completo. 30 personas continúan en el hospital. 11 están en la unidad de cuidados intensivos. 879 son casos aún activos. El día de hoy se reportan 3 fallecimientos. A la fecha, los fallecimientos totalizan 812 personas. Afortunadamente, los casos positivos, así como hospitalizaciones, continúan declinando en nuestra área, así como en la región. Cualquier persona que esté completamente vacunada puede participar en actividades al aire libre y bajo techo. Monitoreamos regularmente nuevos datos para informar nuestra orientación y toma de decisiones. Si está completamente vacunado, está protegido. Durante las últimas semanas, los casos han seguido cayendo drásticamente. Nuestras vacunas están funcionando, son 90% o más efectivas. Son eficaces contra el virus SARS-CoV-2 y las variantes. Si está vacunado, es menos probable que propague el virus. La vida de las personas vacunadas puede volver a la normalidad. Desde el 19 de abril, cualquier persona mayor de 16 años ha sido elegible para la vacunación. Y desde ayer, la vacuna Pfizer está disponible para mayores de 12 años. Tenemos un fuerte suministro de vacunas. Estamos abiertos en el Centro Comercial La Palmera de lunes a sábado de 10 de la mañana a 8 y los domingos de 11 de la mañana a 6 de la tarde con las 3 vacunas disponibles. También abrimos el Centro Greenwood para niños de 12 a 15 años. Si va a viajar, se le pide que use un cubrebocas. Los Centros para el Control de Enfermedades continuarán actualizando sus guías. Los viajeros internacionales completamente vacunados que lleguen a los Estados Unidos aún deben hacerse la prueba dentro de los 3 días de su vuelo. Usted no podrá saber si alguien a su alrededor está vacunado. Por eso lo alentamos a todos a vacunarse, disfrutar de los beneficios y proteger a los demás. Una persona considerada completamente vacunada es la que tiene 2 semanas después de su segunda dosis en una serie de 2 dosis o 2 semanas después de la inyección única de Johnson & Johnson. Si no está completamente vacunado, le pedimos que siga tomando sus precauciones. Si usted tiene una afección médica que debilita su sistema inmunológico, es posible que no esté completamente protegido, incluso si está completamente vacunado. En este momento, las vacunas disponibles protegen contra las variantes. Durante el año pasado se ha demostrado que el virus es impredecible. Siempre existe la posibilidad de que estas recomendaciones cambien. Un niño menor de 12 años que no esté vacunado aún deberá tomar sus precauciones, incluyendo el uso de un cubrebocas. Los cubrebocas en las escuelas todavía son necesarios, ya que la mayoría de los estudiantes no están vacunados. Los maestros y administradores deben de seguir siguiendo las pautas de los CDC. Las personas completamente vacunadas en el trabajo deben seguir utilizando un cubrebocas si es que así lo exige la ley. Lo mismo para oficiales penitenciarios y en los refugios para personas sin hogar. Le recordamos que los CDC basan sus recomendaciones en información científica.
Thank you. That concludes our press conference. We will be back 2 weeks from today, and then after that, we will be giving the press conference once a month, starting in June. Thank you.